he basically told me that it was psychosomatic due to stress, because at that time I wasn't working. I'm used to having 2 or 3 jobs. Yes, I know. At that time I wasn't working, and then that issue happened. He gave me medicine, steroids, and anti-inflammatory corticosteroids to take, topical steroids, and it actually made it worse.
Stop there. I'm sorry to interrupt. We need to write down all this. This is very important information. Mm-hmm. So we need to know what she did, where she went, what was the diagnosis, and what medication she was given, and if she's still taking it. We need to know what medication a person is taking. Because when we do herbs, there are herbal, you'll see that next year, but there are contraindications and interactions, so we need to know that. And some herbs are like Brahmi, we have to be careful with that because it has a lot of interactions, okay?
So the oral medication that he gave me was prednisone, and the topical one was called it was some type of steroid. It was like a 1%. I had tried everything that I could for eczema or whatever I thought it was. He didn't really give me a clear diagnosis of what it was. He just told me it was like dermatitis. Psychosomatic induced dermatitis from stress.
But you stopped taking the...
Yeah, I stopped taking it because it made it worse. Both the oral and the topical just made it worse. It made my skin... It looked like if I got burnt. Like literally my skin turned black and hard. Yeah.
Steroids affect pitta. Antibiotics too. Increase pitta. Both steroids and antibiotics. So sometimes they're detrimental to the condition.
So when this started, I had actually noticed it was just a very light rash at first. It started off on the fingers. And it would go away. And then it would come back. Not as bad. It would go away. But then I noticed sometimes that I was like really like worrying about finances and work, and I'm at home all day cleaning. I gotta do something because I feel I need to, like I can't stand still. It started going more up the arm, and my hand started to get inflamed, like to the point where I couldn't close it because it was so swollen and red and inflamed that if I were to do this, it would break skin, pretty much. It went on for a couple months, maybe, I want to say maximum of 8 months.
What was this? Remember, Ashley, what was this?
This was when you first started seeing that, so
It was like 2 years ago. 2 years ago. Yeah, maybe 3. I want to say like 2013, 14.
And you have you had it since?
Well, this was the thing. I ended up going to work. I had to go. Just had no choice. I had to go. And it kind of alleviated a little bit. But every once in a while, or every so often, I would break out. Not as bad as that one time that I went to go see the dermatologist, because it was just really bad. And after a consultation with an eye and started doing the regimen, it did help a lot. But obviously I wasn't consistent with it. I wasn't so strict with it. So there's times that it does come back, but not as severe as it got. But there's
just now you're working.
Yeah, I'm working. Not working yet. And also doing yoga, or CrossFit, or gym. So it's, I don't know, doing things.
Okay. Don't let a client limit linger on the subject for too long. Otherwise, you're going to be in a consultation for 5 hours.
Yeah.
Careful with that, because some people like to tell you every single thing. Pitas are very detailed and Vatas just go from one to another. So you have to be careful with that. You need to be in control of what's going on. When you have the information, you need to let people talk, but when you have the information, okay, what else? Some people come from different things. So what, is there any other thing that...
Is there anything else that...
You don't feel comfortable about something because there are a lot of people who don't do it. It's okay.
I can't think of anything else. I mean, that's the example I use because I can't think of anything recently.
So we move on. What will be next?
Do we ask about like the diet at this point, or we ask about?
No, diet comes later on. I'm trying to follow what you have here. But before we go into all this, you need to know her family history. About her medical history. That's important. Even though we're going to leave that out, because I think that will be for next year, or just clinical, okay? What you're doing this year is just, we're going to follow this. We're going to follow this much better. Menstrual, facial, voice, breast milk, sweat, urine, feces, skin, balls, stomach, okay, so yeah, we're gonna leave all this out. So we need to know about her diet and lifestyle, basically. Diet, lifestyle meaning what type of exercise she does and what's the sleep patterns. Sleep, exercise, diet, and energy levels during the day. That's very important. Energy levels during the day. Also, along with diet, substances. Substances, I mean stimulants that she may be taking and how much.
So, what do you eat for breakfast?
And we want to know one more thing. And we want to know about appetite, digestion, elimination, urination, and hydration. This would be the part about you went through the whole thing about how to do an intake, right?
The 8-fold. Yeah.
So this would be the conversation you have with the person, the information you get, without still going into pulse, tongue, hair, whatever. So this is the basics.
Right.
If you go into clinical, there's more, but I think this is what we need right now. You know. So let's do this and try to get out of this. Don't get a full story out of each.
Yeah. Okay. So.
Would you say that your appetite's good? Do you want
Yes.
all your meals?
I'm hungry all the time.
Your appetite is good is never a good question. Sorry.
No, but I followed with, do you want are you hungry for all 3 meals?
Okay, good. Because when you
Yeah,
say your appetite is good, people are going to say yes or no, but that's very subjective. So we cannot go into that. A good way, are you hungry when it's time to eat?
Yeah, like all 3 meals on time.
Hungry all the time.
Okay, that's good.
Okay. And so do you feel like you digest the food immediately after you eat it? Do you feel like your digestion is overactive? Like how soon after your meal are you hungry for the next something else.
5 minutes later.
Would that be?
That will be tough for many people to come into those. You're asking people to just have a lot of how do you say, connection to themselves. People don't even know the color of their nails. So asking about digestion, they have no idea. You have to tell them something that will, or it's better to tell them, ask them something that then they can relate to. So for example, do you have any type of bloating or gas or acid reflux, which is the common things that we have in digestion? Do you suffer from any of those? If they say no, you say, so you digest everything pretty well, right? You never care about it, or you can digest the stones or whatever, and they say, yeah, I can eat anything. So you know what's going on. Heartburn, acid reflux, whatever of those.
Do you have acid reflux or
I know usually the only time I get like heartburn is if I'm drinking. If I drink.
Okay,
Do
that's
you
important
drink?
information.
Drink coffee.
That comes with the stimulants, maybe.
No, I'm not talking about coffee. No alcohol.
How often do you drink alcohol?
It's not really better. Now I'd say like maybe once every 2 weeks.
So when you drink, it's a lot.
Say it. We can't take it down.
I'm not judging.
Say it.
Erica, I honor your courage. Really.
I know, I'm over here sweating.
No one here is judging you.
Nobody's judging.
And it's okay. Thank you for sharing with us.
Yeah, thank you. No, it has gotten a lot better.
That's
How old are you?
33.
She's a young man. Still trying all that.
Do you drink a lot of coffee or any sort of like energy drinks or
No.
something like that?
Sodas would be a question there.
Soda, no. I hardly drink anything. I don't really get thirsty. If I do get thirsty, it's usually water that I drink.
Smoking would be a question there in the stimulants.
I don't smoke cigarettes.
Drugs would be a question there.
Yes, I'm a recreational smoker.
You have to ask, you have to get more information about it. Sorry. I smoked all the hashish that there was in Spain. I have to inform more, I think. I'm still here. Don't worry about it. I don't smoke anymore.
In my heydays.
It was aggravating my vodka. That's the only reason I stopped.
So we need to know. Most people will be will do marijuana or something like that. That's what you smoke, right?
Yes.
Okay. So we need to know if that marijuana smoking is just that they smoke, here and there once a week, whatever, or if it's like 3 times a day. Because it's a completely different story here.
Pray tell.
It's definitely everything.
Your massage therapist, that cafe is protecting you so much. That cafe is your best friend. Smoking marijuana and doing massage. Oh my god, that's a depleting thing. But anyway, now you can do it.
About maybe like twice a day the most.
Okay. So you're getting good information. You got sidetracked at one point because we're talking about appetite, digestion, and then we jumped into coffee and stuff. And I do that, but I always go back to where I left. So we were talking. You do appetite, digestion, elimination. And then you get the 3, and then you can see acne.
I'm gonna go if there's any constipation or anything like
Okay.
that.
Yes, the last couple of weeks, yes.
And how long does it usually take, like, in
sleep, like I've been going the last couple of weeks, like maybe once every 2 days. And it's been,
And is it like a
it's
full?
not finished, no.
So we
It's
just
rabbit.
appetite, digestion, elimination. We just here we can already do a diagnose of acne and Costa. Are familiar with acne and Costa? Costa, you haven't been there. The way the bowel movements go. Cruda,
No.
cruda, mrudu, amadya.
That
Mrudu,
sounds familiar.
Those are the ones.
Yes. Soft.
soft.
Oh, like the
Mrudu
what
would
the
be like a
qualities?
pita,
Yeah,
kind of.
the-
Cruda would be like a constipation, and madhya would be like a kapha, regular stuff. You haven't gone through that, the costas. Okay.
So it's Tikshna Agni, but
Yes.
with
Cruda,
Ruda.
right now. Tikshna with cruda. And the agni can be vishama, can be tikshna, or can be manda. Have you gone through that? No? Okay, so we're jumping into something here. But anyway,
Yeah, let's not jump.
The one does the whole, and the other one is.
No,
you know what?
you said
Variable.
sharp.
Variable.
Tikshna is pita, vishama is variable, which is a vata, and manda is low, which is
Wouldn't the reason that she's hungry all the time, the marijuana as well, that called this stimulates
because I don't get
high
hungry.
pita.
I think
High pita, tikshna, agni.
I don't actually get hungry when I smoke, but I get hungry when I drink. So,
Tikshna agni, marijuana also gives you the
munchies.
the munchies. But for a person like Erika being
It's
a
very-
strong pita,
It's very drying too.
Yeah.
Yeah.
Marijuana. So it can cause constipation.
it goes what?
constipation.
Constipation.
Yes, because it's
Dry.
dry.
Well, it's vata provoking, so it's vata
So all
provoking.
smoking in general is vata provoking? Or it's just marijuana?
It's tridosic provoking.
Okay.
Smoking is tridosic provoking,
Any.
and alcohol too.
Okay. So.
So now we can jump into
Her diet or
Yeah.
sleep?
sleep.
How's when do you usually go to bed really late, right?
Yeah.
Like what time?
1, 2. Last night I went to bed at like 4.
My shift,
Yes.
Because I sleep the night, I don't have a problem.
Is it because you're doing things, or you just have a hard time falling asleep?
Last night because I had a hard time falling asleep, I had to go downstairs and eat a lot of food. It really did put me to sleep.
It's heavy foods. That's a way of.
I had peanut butter, milk, bread. Oh my gosh. Turkey.
Turkey.
Turkey, turkey slices.
Turkey helps you sleep. No, seriously.
Tryptophan.
Turkey has this thing that.
Okay,
Turkey, a whole turkey leg, or
When
like
you
7 slices.
when you fall asleep, do you sleep through the night, or do you wake up at all?
It varies. It varies. I could sleep through the night, or sometimes I'll wake up like every 2 or 3 hours. I'm not like I guess I'm a light sleeper. If I hear noise, I wake up.
So that's vata. Do you notice that you wake up at a specific time?
Yeah, I always tend to wake up at 3 in the morning. Yeah.
That's vata.
And do you go back to sleep? Or you
I look at the time, I'm like, what are you doing? Go back to sleep. Go to sleep. Get some rest.
And then what time do you wake up?
Well, when the girls were going to school, I would wake up at 5:30 to go wake up my oldest child, and then I'll go back to bed and wake up like around 6:15, whenever she's ready, and then take her, and then come back. And then by that time I'm off. I have to
in school?
Now, the summer, since they're sleeping, since they're not at school, I can sleep an extra 2 hours.
So you sleep until 8?
Until like 8, yes.
When did they, like, did you notice that your mom movements coming when you started waking up later? Do you notice that summertime changed anything? Like when you stopped going to school?
Yeah, this week, the last couple days has been a little bit more normal just because when I wake up, I have time to actually sit down and not get up from there until I'm done. So, yeah, I guess that it has changed, but I mean, it's only been for a couple days.
So it seems like it's gotten better now.
Yes.
There's less chaos going on first thing in the morning. Because that can cause a lot of, if you like are thinking you have to do something, you have to do something. Like, I know the first day of school, when we start school again, I'm not going to go to the bathroom very well in the morning because I'm like, I have to do something.
You need to allow time for your bowels.
Yeah. Okay.
If anybody has anything to say, please speak up.
Yeah, sorry, because I'm writing.
So we go now into the diet. We know the lifestyle. Ask about the
Energy levels and exercise.
Yes.
How's your energy throughout the day? Do you feel like you get tired at any point during the day?
Tired? No. Lazy? Yes. No,
That must be the smoking.
No, not even, because I don't go to work like that. But I'm lazy. I don't feel like going to work. No, actually, my energy levels are pretty good. At work, they're always like, I wish I had your energy because you're always moving around. I always have to do something. If I sit still, I just don't get like anxiety, I guess you can say that.
So you do get anxiety?
Yeah.
At work or anywhere when you're not sitting still?
When I'm sitting still, period, I get anxiety. I feel like I need to do something.
And when you get the rash, do you notice that you have more anxiety or more?
Yes, definitely.
Does the working out, because you said you work out a lot, does that make you feel more anxious? Do you feel like it makes you tired and that's why you don't
Calms me down.
calms you down? But do you feel like it's because you're overexerting yourself, or you feel like it's because you're getting out that anxiety?
I'm releasing that energy. That's what I feel.
Be careful with those questions. Again.
Because people aren't aware.
Or they are gonna say you whatever. That's not for them to answer those questions.
What would you ask there?
People will tell you that they feel really good when they come home and they run for 20 miles after being cooked up in the office for 10 hours. So they're gonna tell you that they feel really good. You know that body is exhausted and that's what they're feeling.
Yeah.
So they will never be able to associate that the next morning they're gonna be even more on the edge. So don't try to make them come up with conclusions about what they're doing. That's your job, basically. That's your job because you know more. You know about the beta kappa, how they work, and you know what they're saying. Okay. And sometimes you're gonna see that they contradict themselves very often, actually. So you have to read between lines. Just go to the facts. Like, do you exercise? Yes. How often? Every day. What do you do? I go to the gym and this and that. And you start seeing. She goes to the gym in the morning. She does yoga in the afternoon. She goes to the gym in the evening. Okay. We're seeing a pattern here. What is the pattern? Okay. You may ask, why are you doing it twice a day or 3 times a day? And then she can come up with something, you know. But otherwise, it's for you to take the conclusions out of these things. What is Pita? What is Vata? What is Kapha? That's a way of doing it in the beginning. You see what's beta, what's beta, what's kappa, and then you see the imbalance just by how many P's, how many V's, how many K's they get.
Okay, and your diet. What do you usually eat for breakfast and when?
Breakfast when girls are in school, I tend to eat like around 7. It usually consists of like 2 eggs and toast.
Do you snack in between breakfast and lunch?
Sometimes. I'm always hungry, so usually yes.
What do you usually have in between?
Whatever I can find.
That's pure honesty.
I love you, by the way. I just have to say.
Just don't go into the blue corn, super organic chips, whatever.
Oh my god.
Whatever moves around.
Thrillers.
Let me see. I had breakfast yesterday, and then for snack I had some chocolate chip muffins, and then a bag of barbecue chips,
Okay. Sweet salty, so you want sweet salty.
and the chocolate milk. And a Sprite on the drive.
So you usually drink soda.
I had a Sprite. Yeah. I usually don't drink soda, but it was the only thing that I could pick up and go. Let's go. I didn't feel like sitting there and filling up the water bottle where I sprayed it. I didn't even drink it all. I left it in my car. When I got in my car, I was like, oh, it's still here.
What time do you usually have lunch?
When I get back from aerial yoga, I get home like around 11:30, 12. If not, as soon as I get to work, so maybe like 1:30 the latest.
And what do you usually have for lunch?
If I am bringing my food to work, or if I eat at my house, it's usually like chicken with sweet potato, or like asparagus. I like vegetables, so I always try and incorporate some type of vegetable. If I'm at work, then I'll eat salad, soup, salad. This is all the food that I eat. Oh my god. Soup, salad, and whatever else they have. Maybe they'll have rice and fricassee that day, or maybe they have rice and breaded chicken.
Whatever you could
So
find.
we're at the Intercontinental?
Yeah, we have like
The restaurant? They have
it's like, yeah, it's the employee restaurant.
Oh, okay.
Cafeteria, yeah. So, it's $3. I'm like, I'm there.
Yeah.
All you can.
Oh, you can.
Everything, dessert, bread.
Do you usually snack between lunch and dinner?
Of course I do. Of course I do.
Same kind of thing as
Whatever's available. I usually try to do like some fruit if I can sneak it upstairs. If not, lately what I've been doing, instead of eating something, I've been drinking tea.
Oh, good.
Just to kind
and
of.
taking a walk.
Well, I'm never still. I'm always
You're always
folding towels, moving stuff, checking laundry.
What do you have for dinner and when?
If I do get home and have dinner, it's usually after I work out, 11:30 or later. And honestly, it'll be like either a sandwich or what do I do? It'll be like junior bacon cheeseburger. 4
Order your
for
chicken
4.
cheeseburger?
Or the 4 for 4.
What?
4 for 4?
4
That's
for 4.
What is that? Praise
That's
God.
That's a junior bacon cheeseburger.
4 times.
A 4-piece chicken nuggets, a little fries, and a soda. Or whatever drink you want. I get the tea. I'm hot. I'm hungry.
She's blessed. She really is blessed.
Okay.
Alright, so we got the diet. We got the lifestyle. We got pretty much all the information we need right now. So now we start checking her out. With all the stuff. So what would be the first thing? I see here you have stuff like, it's important to talk about the period, menstrual. That's another thing that needs to come up with women. So we'll just go into that. We need to know if it's regular or irregular. We need to know the duration. We need to know the flow. We need to know if there are cramps, clots, and PMS. As you can see, there's a lot of information, so we need to be very strict to the point, okay? Otherwise, we're here forever.
Do you get your period every month? For how long?
5 days that I see blood, and then maybe like 2 spotting, I guess you can say that. It like spots and then blood and then it spots.
So 7 days total. Do you get cramps?
No, I hardly get cramps.
And do you get a lot of clotting? Is it just an easy flow?
No, easy. Yeah.
Do you get very emotional around your period before, during, and after?
Before I get moody. So I've been told.
Moody, sentimental, kind of
I'm
subtly.
sensitive and I'm moody and
Do
I've been
you,
called bipolar.
do you guys know what that means? What kind of PMS that is?
No.
It's cough.
The sentimental part?
Pitta is aggressive, it's irritable, it's
But
not
you said you
patient
get
as well.
both, right?
And like
Yeah,
seven,
insomnia,
like seven,
bipolar,
nothing
nothing.
was
Vata is more about fear, insecurities.
Oh, I'm just getting so sad, like out of like.
It's kaphas. So this is very important. PMS will, at that time in the month, you guys get rid of everything that you don't need. The blood being one, the dirty blood. But along with that, will go out all the emotions that you have been bottling up during the month. So whatever you don't express for whatever reason during the month will come out that week, because the body cannot hold on to that. So if the whole week, the whole month, you have been harboring aggressive thoughts, frustration that you cannot speak out, then you're going to speak everything out at that point. If you have been sad about something, not happy, then at that point you're going to start, all the crying, all the sentimentality, all the emotional. If you don't feel secure during the month, at that point you're going to go into all these fears out of nowhere, or all this stuff, and you're asking yourself, where does it come from? It's just your emotions during the month. So you need to pay attention, very good attention to that, and then see where you are repressing. Remember, repressing emotions is the cause of cancer and many other illnesses. So we need to see where they go, and then we need to understand and learn how to process emotions, which will be a different class. Okay? And that's very important to know what's going on in PMS. We just need one more question from you. It's your flow. Is your flow light? Is it medium? Is it very heavy?
It's medium.
And sometimes we ask for the color as well.
Right.
What is the color of the blood?
Red.
Intense red?
It varies from like a pinkish red to brownish or dark red.
Okay. So strong red is pitta. That's how pitta should be. A dark red is more like a kapha, and a brownish is normally being vata. Okay. Vata is scanty, it's light. It lasts for 3 days. Pitta is 5 days. Kapha is 7 days. Which is a pitta kapha, so it goes 5 days with some spotting. Medium to heavy. Heavy would be kapha. Medium would be pitta. Okay. And then that's where we find a lot of hormonal imbalances, the menorages, the amenorrheas, the dysmenorrheas, all this stuff, But she doesn't seem to have anything. There's no clotting, there is no cramps, which means it's flowing, there's no stagnation, basically. So the uterus seems to be free from emotions. So it's a lot of emotions stuck there in a woman, so she doesn't seem to have any of that. Okay. So now we start with all these things. Here you have the facial diagnosis. So we look at her face. Do we see anything?
I could feel weird right.
You don't do that, okay? You just look at them you don't even tell them that you look at them and look at the face. You just look at them and just write down whatever you see.
Oh, creepy, like.
Yeah, otherwise people feel that that's very creepy.
We've been doing this like every week, so it's
But you don't need to look so carefully. You look at me, Erica, please. Okay, that's it. What do you see?
I see
Kapha, pitta,
her eyes are a little bit watery. A little bit.
Don't be so picky. Don't be picky in facial expressions. If you have something to look at, you don't even need to look like this. It comes out on you. There's nothing that what are you looking for? There's nothing, right? No, nothing.
Nothing specific.
Nothing specific, because she has nothing specific. There are no lines on the forehead. There are no lines right here. There are no lines out of the eyes. There are no malabsorption. There is no problems with the reproductive organs. There's no hemorrhoids.
What are the
There is
reproductive
no-
organs on the face? What are the reproductive organs?
Many places. Right here, a line, this line here, it's weak reproductive organs, and line right here, lines here. This is all reproductive. Okay. What else? There is no double chin, which will be something about the thyroid. Okay. There is no hair in the ears, will be heart problems. There is no this thing here, like a little thing here that is high cholesterol, or then
What is
here.
the
It does like this, the ear. You'll see in your stuff. You need to see a picture of it. What else? Oh, there is no adrenals. There is no kidneys, because you would see the bags. These adrenals and kidneys. There's adrenal fatigue in there. You've been through this thing now, the facial.
Not in this detail.
So much detail.
And actually, I'm feeling a little insecure about tomorrow. I am. Am I the only one?
No.
Okay. I'd rather observe. Because I don't know what we're supposed to do when someone comes. I don't know what the people from the street are expecting from us.
Not much.
Okay.
Not much. No, not in that sense. They know they're coming. They know it's a free consultation. They know you're students. They know what they're gonna be given is not like a full doctor's analysis. They're just gonna be told recommendations on how to behave and what to eat. Basically, that's what we're looking at. But at the same time, we're training in other things, even though we're not gonna use them so much. But it's good. Don't go so crazy about making a diagnosis. I'm gonna be with you. Don't worry about it. But the thing is, when I look at them, I wanna see. If you don't know what it means, write down what you saw. There's lines. There's a line in the middle of the third eye that goes down like this. A lot of people have this. Okay, so you see that. So you write down. There's a line in the middle of the eyebrows. Skeptical personality. Strong pitta, sadaka pitta, very strong pitta. So you have to be careful with that one. because he can put you in a challenge. Above all, if he has a lot of information, he will challenge you big time. You'll have to convince that person if you want them to follow you.
Wow.
So that's how you treat psychologically Vata Kapha, which is, you'll see it later. Okay. But if you don't see anything, you see these lines that I have. This is worry lines. This is the thinker continuously worrying about things. Okay. So those things. I mean, whatever you see, just write down, and then we'll discuss. Because in the evening, in the afternoon, we're going to discuss all the stuff we saw with them. This is our first one. Don't worry about it. Don't worry about it. I'll help you out. Okay. So we saw the facial one. We'll see what's next here. Sputum, I've never taken this one. I don't even know how she does this about the saliva. I don't know.
We were like asking, like when you first wake up in the morning, is it very productive? What color is it? What's the consistency?
I see. That would be tough for a person to answer unless it's there's something really wrong about it. But it's a good question. The voice. Okay. The voice is good to know, and the way people talk. You'll see the pittas are straightforward and very, very detailed. The vatas just go from one conversation to another, pretty much here and then the other way. And the kaphas are very slow. It's tough to get the words out of them sometimes, or information, they don't give you, they're very short in their answers, so that's good. And kaphas have normally deep, mellow voices. Pittas are more sharp, intense. And vatas can be sometimes high-pitched or, stuff like that. Breast milk, that'll be for women. You can ask about sweat. And urine, we saw that urine is one that we need to know. Because we know a lot of things from urination. Do you go a lot? That would be a diabetes. But this is for next year, probably. But at least to know what's going on with urine, maybe.
But going a lot is also pita, right?
Isn't it kapha when you go a lot?
Kapha goes more often than pita, and vata is the least. Just the more liquid you have, the more you
Okay.
No, I don't go to the bathroom a lot. Like urine.
When you do, what's the color? I know we did.
Last time, this morning it was like a bright yellowish.
Right now. Does it have a smell to it?
Yeah, it has a pretty strong odor.
Okay. So this is the important part of at this point, this is what we need to know. If it's yellow, if she doesn't go too often being a pita, and if there is an odor to it, that means that their hydration is poor.
Yeah, well, she already said she doesn't drink a lot of water.
So this is confirmation of hydration is poor. Because they can tell you whatever. For some people, I drink a lot and they drink 2 glasses of water. So
Pretty sure.
if they say that the urine is very whitish or very clear, then they drink a lot, maybe too much, and they're, flushing out all the minerals. So we need to restrain the 20 glasses a day that they're drinking, and say you cannot drink so much, or you have to drink a solution of water with lime juice and salt and sugar or something. Okay. Urine, feces, skin. Okay, skin is important. How's your skin? Is the skin dry? Dry skin will indicate vata. Basically.
I forgot. Well, I didn't have time.
If you look at their skin and you see freckles, that would indicate a pitta type. Freckles are pitta.
She's got more kapha skin. Like it's really soft and well hydrated.
Soft and well hydrated, and she doesn't hydrate, she still has that, so the skin is kapha in this case. But we're looking at that to see both what she is.
Well, because there's no rash that she was having issues with. So that's
Let's go into the tongue.
Right.
Somewhere.
Oh, yeah.
Normally when we do a tongue, we need a little flashlight. I use my cell phone. We all carry a cell phone these days, so we may as well use this. So I normally use this. See if there's a look. I use it. Now you have to be quick. You can ask them to close and again open up if you want to see more, because you cannot have somebody like this for 5 minutes, okay? So you have to let them. Actually, it's not a joke. People will be really uncomfortable. Do it again. What do we see?
So a little bit of like in the intestines.
Yes,
like that.
there is ama in the
But that makes
intestines.
sense because she says she's been constipated.
Yes. Look at the tip of the tongue. Look at all this
A little
area.
bit of the red little.
The dots, red dots, a strawberry tongue. Red dots on the tongue, strawberry tongue. We call it hypita. Hypita. Okay. See, doesn't have. It's a kappa tongue. It's mostly a kappa tongue.
Could that be the red dots? Those could be.
Yeah. You see the red dots? On the.
Yes,
You
yes,
see
I see them.
both sides.
It's different than the
Little
last time we did
little
the.
spots.
Yes, at the tip. Look, she has a lot.
Let me see.
Oh, wow.
You see a lot of red dots. Come here,
So that,
Paula.
what is that?
You get to see that
yeah.
red
Like
dots
that.
there. Okay, so look at this tongue. There is ama at the back
Yes.
in the large intestine, but there is not so much ama. Now, how come there's not so much ama? Because her diet is it would tell us that there should be more ama. She's constipated and everything.
Yes.
So some more ama. The what?
It's in the datus?
It's because of the smoking. The
Oh.
moment a person smokes or drinks, it pushes the ama into the deeper tissues, so the tongue looks clean. Don't think that they don't have ama. It's just being pushed downwards. So there's still ama. It's not showing. So whenever a person drinks alcohol or smokes, it's burning the ama. That's what alcohol and tobacco does. It burns ama. They're fire, both of them, right?
Right.
So they burn the ama, goes in. So it's not that you don't have ama.
Has more.
The back of the tongue right now has more because there's probably a lot of ama there, because you're not going to the bathroom being a pita. So evidently there is a lot of ama in your intestine, your large intestine right now. That's why it's still showing. Okay? So that's how we look at the tongue. And the final thing will be the pulse. What I want you to do tomorrow is you're going to take the pulse, and you're going to take the pulse, all of you. You're going to be divided in 2 clients, and you're going to be 3 and 3, and one of you is going to lead the consultation, and the other 2 are going to be assistants. And if the leader misses something of all these questionnaires that we have, then you can ask a question, or you can say, hey, what about this? And the person that's leading will ask the question, okay? By the end, the 3 of us, or the 3 of you, are going to take the pulse. And I just want to, I don't know what you learn about the pulse. You learn what? Prakruti and Vikruti, first and seventh? Prakruti, the 7th, you go deep to the deeper level, you stop the blood, and then you let go a little bit until it comes. That's the one you learn? Okay, so I want you to go there tomorrow and see what if you can start feeling the bumps, okay? And see if you can count the spikes. How many spikes do you get in Vata? In the
We didn't really.
you didn't go through that. How did you do that?
It was very quick,
and
we just felt what we felt, kind of thing, and
Yeah.
just described
Just
what
let
we
them-
were.
So you haven't gone into
No.
into pulse analysis yet.
No.
Not really analyzing it, just kind of feeling
Getting a
it.
feel
Yeah.
for it.
So what we're gonna do is this. I want you to go into the pulse tomorrow. Go to the deep level.
Yeah.
Okay. Stop the circulation. I mean, don't go like this. Okay. It's slowly, because otherwise the pulse doesn't talk to you. You go to the deep level. You stop it. You let go a little bit, and when you feel the pulse coming, you're gonna feel a pulsation in each one of the 3 fingers.
Yeah.
I just want you to write down what you feel. Is it a strong? Is it sharp? Is it weak? Is it mellow? Is it cold? Is it hot? The pulse is a lot about an inner feeling. It has to talk to you. It's not so much what you feel here. And be aware of things that may come to your mind when you are in the pulse. When we take the pulse, we are entering the prana of the person, the life force, and we get messages. There will probably be a witch among you, and the witches will get it much faster. When I talk about a witch, that means a person that is much connected to the subtle world. Okay, so the witches will get this much easier. They will get sometimes visions. Sometimes, normally what you get is a message about what's going on. I remember one of my teachers taking a pulse in clinical with me, with this woman, and she went in. I went in first, and she said, "What do you see?" I mean, it was just clinical, and I just told her, she has this and this and this and that. She went, "Okay," so she goes to double check, and in the middle of all this, she goes like, "What did you find in 6th level?" I said, "No, I ain't got very much." And she goes like, "There's an emotion stuck." And she was amazing, this woman, by the way. All the best pulse therapists I've seen. And I know her. And then she went like, "Oh, there's a loss. An animal." And the woman started crying like crazy. Her dog had died 1 week ago. 1 week before. So she sensed that just in the pulse. There's no way you can learn that. There's nothing that tells you the dog died. And there's a spike on this. She just picked it up from somewhere.
She connected with her.
We all have that. We have to believe it, and we have to get attuned to it, and it will talk to us. But you have to be in the pulse, and you have to stay there. Sometimes 5 minutes. I remember this guy, I took my wife to him, another amazing pulse taker. He's in upstate Florida. Oh my God, that guy stayed for 20 minutes like this. I thought he had died because he's so old. And I was like, "What's it, Mike?" Because I thought he had died. I mean, he was like, and nothing was happening, and my wife was like, and then eventually he said, "Do you have any problem with your uterus?" And she said, "No, I don't have any problems." "Are you sure you don't have any problems with your uterus?" "No, I don't have any problems." And he went like, "Sometimes I hear weird things, you know." And we said, "Okay." The following year, cancer.
Oh, wow.
I mean, not cancer, the little crazy cells. What do you call that?
Like hyperplasia, dysplasia.
Yeah, that thing.
Yeah.
The little that they cauterize and that's it,
Yeah,
you know?
yeah.
It's the beginning of cancer if you can take care of it. And she went for an exam and she called me up and she said, "Hey, they say they have this." Wow. And the first thing that came to my mind, it was 1 year. I said, "Mike," and she said, "That's what I thought." I said, "God damn it, that guy's good." But that guy's amazing. That guy it's like Dr. Life. So, but that will talk to us if we allow it. So for tomorrow, we go in and we feel it. And we look at the face and we look at the tongue. And we see whatever thing in the tongue, we don't know what it is, you write down. There's a bump, mid-tongue on the right side. You can draw a tongue and put where the bump is. That's what we used to do, okay? And you tell me, and then in the afternoon we're gonna see what it is. And little by little we'll start learning from experience. And that's the fun part, not from a book.
Yeah.
Right? But with all these questions we're gonna ask from the person and look at them, I mean, tomorrow we're gonna give her recommendations in the afternoon if we have time. I want you all to, with all this information, give Erika some recommendations, see if we can come up with 4 things she can do. Okay? So that's what we're gonna do with them tomorrow. Just see the diet, the lifestyle, and say, okay, you have to go to sleep at this time, you have to get up at this time, you have to eat these things for you. Your fat is high, your pita is high, we discuss it. It's fun, guys. It's a lot of fun. Be concerned. It's so much fun. There's no pressure. As long as people don't pay you, there's no pressure. Thank you.
Thank you.
Thank you.
This is the part I like about Ayurveda. Clinical.
Yes.
Even if you don't want to practice, this is where you learn.